Drugs used in obstetrics have a huge impact on the outcome of both the mother and the baby. Drugs used during the first trimester can produce congenital malformation, and the period of greatest risk is from the 3rd to 11 weeks of pregnancy. During second and third trimester, drugs can affect the growth and functional development of the fetus, or they can have toxic effect on the fetal tissues. The drugs used in pregnancy are folic acid, iron, calcium, antihypertensive drugs, and diuretics. In this video, we are going to see about the folic acid, iron, and calcium. Number 1, folic acid. The preparation being as an injection 10 ml vial, and as a tablet it is available in 0.4 mg, 0.8 mg, 1 mg, and the action of folic acid is that it stimulates the normal erythropoiesis and nucleoprotein synthesis. The indications are megaloblastic or macrocytic anemia during pregnancy to prevent the fetal damage, prevent fetal neural tube defect during pregnancy, contraindications being untreated vitamin B12 deficiency. The adverse effects are abdominal cramps, diarrhea, rashes, irritability, nausea, or bloating. The dosage and route of administration 0.4 mg or 400 microgram once in a day orally, or 0.4 to 0.8 mg IM or subcutaneously daily. These are the points to be considered by the nurses when administration of this medication. The patient with history of fetal neural tube defect in pregnancy should increase folic acid intake 1 month before and 3 months after conception. Patient with intestinal malabsorption may need parenteral administration. The next important medication during pregnancy is iron, ferrous fumarate. The preparation, each 100 mg provides 33 milligrams of elemental iron. The tablets available are 90 milligrams, 200 milligrams, 300 milligrams, 325 milligrams, 350 milligrams. The action, it provides elemental iron, an essential component in the formation of hemoglobin. Indications of iron being iron deficiency anemia and as a supplement during the pregnancy. There are contraindications like primary hemolytic anemia, peptic ulcer disease, ulcerative colitis, repeated blood transfusions. The adverse effects of this medication are metallic taste, temporarily stained teeth, nausea or vomiting, GI irritation, and black stools. The dosage and routes of administration are being 30 mg once in a day orally. If it is an injection, 20 mg elemental iron per ml and 5 ml, and 10 ml single dose vial, which is iron sucrose. The dosage being 15 mg per kg body weight, or maximum 1000 mg in single injection intramuscular, or diluted with 100 ml of normal saline for intravenous route. The points to be considered by the nursing professionals during the administration of this iron are: advise the patient to avoid taking tablet with milk or along with antacids. Caution patient to crush the tablet. Caution patient not to substitute one iron salt for another because amount of elemental iron may vary. Advise the patient to report for constipation or change. Another important drug during the pregnancy is calcium. Each tablet contains 211 milligrams of elemental calcium, and the tablet is available in 250 milligrams and 500 milligrams. The action of this medication is that it replaces the calcium and maintains the calcium level in the body. The indication of this medication is that it is taken as a supplement. However, there are contraindications for these medications as well. The cancer patients with bone metastasis, hypercalcemia, hypophosphatemia, renal calculi, adverse effects, headache, irritability, hypercalcemia, chalky taste, nausea or vomitings, and the dosage and route of administration 500 milligram once in a day orally. The nurse or the caretaker has to advise the patient to take oral calcium 1 or 1.5 hours after meals if the GI upset occurs. Monitor calcium level if the patient is having mild renal impairment. Advise the patient to report for any kind of abdominal pain, vomiting, or nausea occurs. No drug should be administered to a woman during pregnancy, labor, and birth unless the woman is fully informed of the known risks and the relevant areas of uncertainty regarding the effects of the drug on the physiologic and neurologic development of the woman or the baby. The drugs that are used daily in obstetrics can have a huge impact on the outcome of both the mother and the child. Therefore, obstetric providers need to have a very clear understanding of the mechanism of action, doses, and the side effects of the most commonly used drugs.